Next on Insights on PBS Hawaii, a follow-up discussion to Haleakala, a trek for dignity. Aloha and welcome to Insights on PBS Hawaii. I'm Mahealani Richardson. With the right support, understanding, and resources, those coping with mental illness can recover and lead full lives. That's the message behind the film we just aired in its broadcast premiere, Haleakala, a Trek for Dignity. In the film, a group of local residents who live with mental disorders hike into the crater and reflect. The film shows a sense of hope and empowerment. Tonight, we discuss mental illness in Hawaii and explore what life is like for those coping with mental health issues. You're welcome to share with us your questions and comments about tonight's show by calling 973-1000 or 800-238-4847 if you're on a neighbor island. You can also watch Insights streamed live at pbshawaii.org. Just click on the title of tonight's show, or you can find us on Twitter at PBS Hawaii. Now on to our guests. Don Lane of Maui is the director, cameraman, and editor of the film Haleakala, a Trek for Dignity. He has bipolar disorder with psychotic features and has experienced symptoms since he was 14 years old. His goal is to diminish the stigma associated with mental illness and help others recognize their voice. Don is currently a media specialist for mental health kokua. Daniel Lane, also of Maui, is a clinical psychologist and clinical hypnotherapist. He's also Don Lane's father. In the past 10 years, Dr. Lane has practiced in Makawao, Maui. Prior to that post, he worked at Maui Memorial Medical Center, providing services for the inpatient and adolescent psychiatric units. NAOMI CROZIER is a mental health case manager, supportive housing specialist, and benefits planner for mental health kokua on Maui. NAOMI also appeared in the Haleakala film, in which she shared her own recovery story. Widowed at the age of 39, NAOMI turned to drugs to deal with her overwhelming anxiety and has been in recovery since 2006. And Tricia Kajimura, based in Honolulu, is the executive director of Mental Health America of Hawaii. The organization promotes mental wellness through education, advocacy, and service. Tricia has worked in human services in Hawaii for 18 years in the areas of substance abuse, child abuse and neglect prevention, and HIV care. Thank you all tonight for joining us on this very important topic.
Thank you.
Don, why don't I start off with you, a very enlightening film that was really personal to you, and why don't you share why you decided to do this project?
Well, you know, I wanted to do this project actually to reach out to others who may be experiencing mental health issues or symptoms of a mental health issue. And the best way for me to do that was to utilize my skills as a filmmaker and put a film together that can reach out to those individuals and speak to them, but also to reach out to the general public and let them know that we are just like everybody else. We can recover. We can be an active part of society.
Now, this trek into the crater of Haleakala was just 3 years ago when you made this film.
Yes.
And you had just started on the road to recovery. Mm-hmm. Talk about how you fell into mental illness.
Well, I first started experiencing symptoms at the age of 14, and I was diagnosed with clinical depression. And at the time, I didn't know what that meant. I just thought that meant, well, you're sad all the time, you know. But it's much more complex than that, of course. So it went from there, just graduated, for lack of a better word, to bipolar disorder. So you know, I've been dealing with this my whole life. I've been coping with this, I should say, my whole life. Mm-hmm. And up till now, I just feel it's time to speak out. It's time to share this. I see this as a movement.
You were, you could say things reached a critical mass when you were homeless. And did you feel at the time you didn't have any resources, any outlet, any care for you?
I did feel that. And, you know, you got to imagine being in psychosis, being in a manic state, your perception of the world is very different. I call it a waking dream. And so when that's going on, it's really hard to see what's right around you, your support base. You know, the ability for medication management, talk therapy, those type of things. You don't see those things because, you know, you're in a different world. It's hard to describe.
Yeah, and Dr. Lane, you know, you were in the film as well, and this is your own son who you saw this progression happening. What was it like for you as a father and also someone with a clinical background? to see this?
Well, it was a challenge on a personal and professional level. When Don was first diagnosed with major depression, he was living on the East Coast with his mom, and I was living on the West Coast. So I was getting bits of information from his mom about what was going on, and I didn't really understand the full extent or the severity of what was happening. The first big event, hospitalization, happened in New York. And it was then that we were talking with the physicians, the psychiatrists at the hospital, and they told us about the diagnosis of bipolar 1 at that time with psychotic features.
And what was the moment that happened that he ended up in the emergency room, I'm assuming?
What?
I can tell that story.
Sure.
Because I was on the East Coast at the time. I was in New York City. I was seeing my psychologist at the time, and he can tell I was in a psychotic state. And he gave me a note, and he said, "I want you to get on the subway, and I want you to go up to the hospital and check yourself in. Just hand him this note." And that was a surreal journey in itself. So I was experiencing these psychotic symptoms, ended up in the hospital. I don't know how I made it. But I did make it, and I was hospitalized at that point because I was going through psychosis.
Dr. Lane, seeing your own son go through this and, practicing in a clinical sense, what did you learn that was perhaps different than what you had dealt with your own patients?
I think because of what Don went through, I've learned a deeper level of compassion for the people that I work with. When I meet with someone, I usually see people once a week for about 50 minutes. And so I see just a really small picture of who this person is and what their life is like. And going through that experience with my son, with Don, when I meet with people now, I also look at the positive traits that they have, not just the symptoms and the problems that they're coming in with. So I think it's really helped me have a much more balanced perspective of the people that I'm working with, more patience, more understanding, more compassion. Yeah.
Naomi, how did you come into mental illness? And this was started when your husband passed away, right?
I believe I got caregivers burnout. The main focus was on my husband who had Crohn's disease. He was dying. He passed away in 2005. And I really didn't have any self-care. And so when he passed, I started self-medicating, and I fell into a drug abuse for about 1.5 years.
Prescription medication?
No.
Or illegal drugs?
Illegal drugs. That was so different for me. It takes all your morals and values and good judgment, tosses it out the window. I became somebody that my family and my loved ones didn't even recognize.
I can imagine that it's so hard, not only for you, but your family members who are struggling to deal with this situation.
Correct.
How did your life make a turn as you were going through this?
Well, I knew this is not who I was, and my family said, this is not who you are. And being in drug abuse at age 39, my son actually came to my rescue and said, look, you're either going to die or go to a prison. So he actually checked me into a rehab for 28 days. And it's very humbling to be checked in by your 17-year-old son. Wow. So I had good support. I'm very, very lucky to have my mother, my brother, and my son who were there for me throughout the whole journey, and is still there to me. So I think it's really important to have good support-based system.
When oftentimes to make a change, you have to hit rock bottom.
Correct.
What was that moment that you hit rock bottom and you went, this has to change?
I believe everybody's bottom is different, so I can't really pinpoint one thing. I just knew that I became someone that I wasn't proud of. When I looked in the mirror, I didn't even recognize myself. And my family members were just there to support me and guide me and push me, ever so gently into making a change.
What sorts of substances were you addicted to at the time? And crystal meth.
Yeah.
And how long did this process last?
A year.
From the time that your husband died to when you actually saw some light in your life?
Well, before he passed, I wasn't using. Before he passed, you know, it's burnout, caregivers burnout. So I think I had anxiety, you know, panic attacks. And so when he did pass, I was sort of just lost. And I ran into a group of friends who was abusing drugs, and I didn't feel like I had a sense of purpose anymore. So when I ran into this one friend who was doing the drugs, introduced me to that, you know, right from wrong, and you know, you like, but I guess you're at a point in time, it's like you don't even care anymore, and you give it a try, and once that, you do that, it hijacks your brain, hijacks your morals and your values.
Tricia, you know, these are very familiar stories to you, aren't they?
Yes, it's mental illness is a really common theme. Mental disorders affect 1 in 5 Americans. So it's very common, and people struggle to find treatment and to find the right help. So one thing that really impressed me about this film was the courage of the people in the film to tell their stories, because that's what's going to make a difference for others. And so I really commend them for doing that and for taking that step.
So you see a mental illness as almost like the baseline that leads to other social ills, because you also deal with HIV, you're dealing with child abuse, homelessness, and other issues, right?
Well, in working in other areas of human services in the past, what I did see is that some of the people who struggled the most with the issue at hand also had a mental health disorder. So it exacerbates whatever other struggles you're dealing with. And there's so many people struggling with that I really saw it as an area that we need to improve in as a community.
Dr. Lane, you know, when you talk about mental illness, there's a big range. Bipolar, you could talk about people who have depression, and these symptoms could be, are they hereditary, or there's usually some sort of trigger in the life?
Well, there's a variety of variables that are involved with mental illness. There's a strong genetic component to it. People who have a family member that has been diagnosed with bipolar, they have a 20% greater risk of having a bipolar episode or symptoms themselves. So there's the genetic part that's involved with it. There's situational things that come up. So typically what happens is that, at least based on my experiences, is that you have someone that's a bit more vulnerable or susceptible to mental illness. And then oftentimes there's a trigger, and it could be an external trigger, relocation, a divorce, losing a job, or something internal. And by internal, I mean the way that we think. Our thoughts are very powerful. Our thoughts can trigger depression, symptoms of depression. So a big part of it is genetic, environment, and also situational factors.
Don, so you led this trek
Yes.
into the crater. How long did it take you to get down there? What, 9 miles to get down and
Yeah, well,
out?
the first day was 9 miles. The total trip was about 15 miles.
So this was a physical trek as well, a physical, mental, spiritual. It was an all-encompassing trek.
Absolutely. You know, I like to say it's an analogy to life and the recovery process. It's physical, it's spiritual, you know, it's mental. It was a challenge in every aspect, in every way. So,
How did you prepare for something like this?
you know, I think it was more about mentally preparing. You know, I've done the trip myself prior to going into the crater for the documentary. I was homeless at the time. I was homeless for a short period of time, and I stayed in the crater by myself with a sleeping bag and a tarp and no tent, and just, you know, laid there. And so anyway, I went through the crater. I experienced it prior, so I knew what to expect.
Naomi, this was your first time hiking into Haleakala?
No, I've actually been in the crater before.
Okay.
But this is an analogy of life. You know, if we can make it through these little hurdles, we can make it through anything.
How did going on this trek, so it was what, 14 miles total, the trek?
15.
15 miles total. How did it change you?
It changed me, I think that's a good question. It's like spiritually, you know, it brought us together. This film made us more transparent about what what happened in life, and what we can do, and what we can overcome.
Yeah.
Brought us closer as as
Yeah.
family.
Yeah, and it was not only individual, but it was a group growth.
Yeah.
You know, and that's what I felt anyway.
Yeah. I'd like to add something about that, the trek. It wasn't just a trek; it was an expedition, and it really was. And by that I mean I have military experience. In the early 70s, I was in light weapons infantry, and we spent a lot of time in the field, a lot of time marching. I was so impressed with the determination, the stamina, the group cohesiveness. Going across the crater was difficult. Going down the backside of the crater, Kaupo Trail, that was one of the most difficult hikes that I've been on, even with the military.
Wow. Now
That
talk
was
about the
tough.
conditions, the weather, the environment. What was it like?
It changed moment by moment. It was changing.
It was dramatic changes. Yeah.
Would have the clouds rolling in. Would have mist. Would have sun. Would be. We were hot. We were cold. Would have to,
And you're packing
shed,
a lot of weight on
and
your
we're
back
packing.
too.
We have a backpack. Yeah.
So you had about what, 20? How much weight did you have on your backs?
Felt like
It
100.
Yeah, that's what it felt like.
Whatever we brought in, we had to take out.
Yeah.
So imagine toilet paper, and any kind of banana peels you need to take out. So we carried all our own gear.
It was amazing how the group really stuck together, but was there ever a moment when one member said, I cannot do this, and the rest of you had to say, no, you
We
can
just
do
sort of
this?
grunted along, going, 4 more miles. It's just,
But I didn't hear anyone say, I can't do this.
yeah.
Right.
Yeah.
Everyone did it. Everyone did a remarkable job. And again, I was just so impressed with everyone just pulling together and making this happen.
I think we all had our own little internal struggles, but the thing is that we overcame them. We overcame them as individuals and as a group.
Tricia, you've watched this film and you've seen a lot of success stories and you see people who are still struggling with mental illness. How do you help them make that turning point?
Well, it's really important for people to have access to appropriate treatment, to be able to recognize when they need help and to know what help is available for them. So I think it's a matter of putting people together with the resources and also encouraging them to build their support networks.
And the resources are out there, but why is it that there are just so many people who seem like they fall through the cracks?
Right. There's a lot of answers to that question. I would say one of the biggest issues is the stigma and shame that creates fear of asking for help, fear of being open about your issues. There actually is a scarcity of resources here and in rural areas, especially with our physician shortage. Not being able to see a psychiatrist when you need one to head off a crisis, not being able to get the medication that you need right away if that is in case the appropriate treatment. So resources are scarce, and it's really something that we need to build on.
Right. It's interesting because on this very show on Insights, we just talked about the doctor shortage, especially for the neighbor islands. Dr. Lane, you must see that all the time. I mean, do you have a waiting list for people waiting to see you?
I have a wait list. As I said, I see about 35 to 40 people a week, and I've been doing that for 10 years, and that number could easily increase to 50 to 60 people a week. I just don't have the time, the resources, the ability to see that many people, because I do meet with people for 50-minute sessions one time a week.
50.
Yeah, 50-minute sessions. And I can get anywhere from 2 referrals a week or calls to 7 or 8. And because I see so many people currently, and because of a lack of resources and availability on Maui, unless someone needs to be seen urgently, I do put them on a waiting list, and the wait list can be anywhere from 2 to 3 months.
So because of the lack of resources, many of these crisis situations, they end up in the emergency room,
They end
right?
up in the ER. They end up in the ER. Oftentimes there's the hospital, Maui Memorial Medical Center, only has, I think it's 12 beds on their inpatient adult unit. So they might end up in the ER. There might not be bed space for them. And unless they're in acute crisis or danger of hurting themselves or someone else, oftentimes they're turned back into the community.
Wow. So if there's no bed space, the ER is full, they can't come in?
Well, the other option would be, again, if it was an involuntary hospitalization, or if they are going to harm themselves or someone else, the next option would be air ambulance over to Oahu and maybe admitted to Queens.
Mm-hmm. When someone has a mental illness, is there such a thing as being healed or fully recovered?
Fully recovered. I think it's more of a management issue. Once someone has a psychiatric illness, they're more vulnerable to having a relapse with that illness. So a lot of there's preventive things that people can do. See a therapist on a regular basis. If you're taking prescribed medication, take the medication as directed. Health in terms of diet and exercise are really important. Staying away from caffeinated types of beverages, drugs, alcohol, stuff like that.
I can touch on that as well real
Yeah.
quick. For me, the idea of recovery for somebody with a severe and chronic mental illness, for example, is somebody who's an active part of society, somebody who can hold a job, for example, and manage the symptoms through medication management or the things that my father just mentioned. So to me, that's recovery. But of course, you'll never be cured. So you're always working on coping, finding coping mechanisms, that type of thing.
And how do you personally cope?
It starts with my support base. You'll see them all around the table right here. But it's also medication management, it's talk therapy, introspective, thinking about trying to understand what's going on, and just always looking for other ways to cope too. Even breathing techniques, like in the documentary. You know, my father taught me the shakuhachi, that wind instrument, that flute.
Japanese bamboo flute.
The Japanese bamboo flute. And with that, I was able to do some breathing techniques that allowed me to calm my nerves and anxiety.
Lloyd from Waialae has a question for Naomi, and he wanted you to describe sort of your mental day-to-day life. How do you cope on a day-to-day basis?
Today?
Today.
Oh, well, I get up, I have an attitude of gratitude, that's for sure. I start with that, and I usually run. I run a couple miles before I go to work, because being a mental health worker, I need to manage my stress level. And then I basically go to work, but I just have a different outlook today. I really take a look at self-care, what's important to me. And, I have a lot more compassion today because for what I do. And I try to show the people I work with and the people that I work on the streets that anything is possible. Because remember, I'm born and raised in Maui, and I know a lot of these people that are on the streets. I know the people who are suffering, and I know that it's hard, and I give them a little bit of hope. And sometimes I share my story. I try not to disclose too much, but when it's appropriate, I do.
Do you feel that helping others has helped your soul as well?
Definitely, definitely. And what it does is, just sharing my story, I may be able to help someone who's in a caregiver burnout, or is just stressed, or just having a hard time in life. I think just by sharing part of myself to them helps a lot.
The interesting thing, Tricia, we haven't really talked about statistics of mental illness in Hawaii. Are there statistics out there, and how many people who might be affected by something like this?
Well, the kind of general overall statistic is 1 in 5. And then when it comes to serious and persistent mental illness, 1 in 25 would be your ballpark figures. So it's a significant amount of people.
Right. And then for you, you're actually helping people get to the resources they need. So how do they find you?
They can find us on through our website. We have a Facebook page. We get calls from people every day looking for resources, and we try to connect them with what's appropriate.
Right. Earlier you mentioned the stigmas of mental illness, and in the film, there was a big part of it was the Native Hawaiian experience and the stigma. Do you find any cultural differences in terms of mental illness?
I find that a lot of cultures struggle with the shame of other people knowing family business or what's happening to me when it's not, it doesn't put me in the best light. So I think it is kind of a common theme across cultures in Hawaii, and it does hold people back.
Yeah, I can touch on that too. You know, my mom is from Japan. She's Japanese, and she didn't say a word to her friends about what she was going through. You know, it's really hard. She never grumbled to anybody about me. She just kept it all internally, so I feel really bad.
What about you, Dr. Lane? Was there any stigma on your part dealing with this as a family?
Yeah, that's a really good question. So there's my perception of how I thought I viewed mental illness, and then there was the reality of how I viewed mental illness. And I didn't really understand that there was a discrepancy between the two until Donnie's hospitalization in New York. And I realized at that time, when we were trying to make arrangements for him to come here to Maui so he would have his family support, I felt I was supportive and encouraging. I wanted him to come here. He got here, and then he needed to be involved with the mental health system here on Maui. And it was at that time I recognized the thought of, because I worked at the hospital for 3 years, and I know a lot of the psychiatric staff and some of the medical staff, what are they going to think of me as a father and as a professional if my son has this illness? Are they going to see me as a incompetent professional? I can't cure my son, as a bad parent, and then also how would they perceive Donnie? And I had to do a lot of deep soul searching and come to the terms that this wasn't about me. That this was about my son, and I needed to reach out to him with love and compassion. And who was it? Betty Davis said, "What other people think of me is none of my business." We don't know what other people think. And if we're thinking they're thinking this particular thing, what's going on is really a projection of what we're thinking about ourselves or about someone else. So,
yeah, and if I can expand on that as well, from my perspective at least, my father became very, very supportive. Especially with the documentary, for example, I say, well, I didn't know if you would come on this trek with me, with us. And when I asked him without any restraint, without any thought, yeah, I'll go in with you, and he did. And especially, even from that point on, he's been extremely supportive. Yeah.
Were there times when you felt, when you were in your deepest and darkest moments, you felt, I cannot talk to my father about this? Because he's the person who has to treat people like me.
Yeah, exactly. Well, I want to say there's something also called self-stigma, and there's also a feeling of being a burden to others around you. It doesn't only affect the individual with the mental illness; it affects everybody. So there came a time where I felt my perception was skewed. I was in psychosis, more of a manic state, and I felt like, well, I don't belong here. And that's really at the point where I did become homeless for a short period of time. It was by choice. It was my choice. I didn't get kicked out. My father didn't kick me out of the house. But being in that, it's hard to imagine, being in that state of mind, it's like, well, I don't belong anywhere. I just need to disappear or not be here.
Faye from Honolulu wants to touch upon the issue of mental illness and homelessness. And Tricia, even here in Honolulu, we see it all the time, that someone who clearly needs services is homeless.
Yes.
And how do you help those kinds of people who seem like they're really far off?
We have, the state of Hawaii has outreach workers contracted through different social services providers who are doing that work every day. And what we really need is for the state to put more resources into outreach, because those workers, they know every chronically homeless person on the street, and they've been trying to get them into shelter. So I know that it's possible, but it takes a lot of work. And if we have people in psychosis, like Don was saying, oftentimes they can't consent to their own treatment. Their illness keeps them from seeking help. So we need those people who are working in the street to keep going out, keep trying and building the relationship.
Right. It's interesting you use the word relationship, because there has to be a trust, because I'm guessing that the initial encounter is not good.
Right.
Right.
It could be. Or oftentimes when people have been homeless for that long, have been mentally ill and on the street without treatment, they've already had bad relationships, or relationships with agencies and workers go sour for one reason or for the other. So they need to rebuild trust with a new person.
And on Maui, we have 2 outreach workers that go out into the bushes and actually pull people out and meet up and link them up with services.
What is the mental health and homeless situation on Maui? Because we talk about it a lot on Oahu, but what's happening on Maui?
It's there, but we are working really hard to get people linked up into resources and get them into the shelters, get them health care, housing, therapy, medication management. We at MedHealth have a wraparound services, so it's really a unique situation. It's really good.
We're actually losing we've lost some resources, mental health resources on Maui. We had the adolescent residential or inpatient program that closed down at the end of last year, and that program has opened and closed at least a few times throughout the years. And then the beginning of this year, we had the partial hospitalization or the day treatment program at the hospital that also closed down.
Maureen from Kona has a really interesting question, and she says, how many people may be out there as functional folks with mental illness, and are they just one trigger away from having a crisis? It's unseen, it's unknown?
Well, I don't know. I don't know the answer to that question. What I do know on a national level is that there's 60 million people in the United States a year that have a diagnosable psychiatric illness. And that's comprised of about 44 million adults and 13 million children and adolescents. And out of that 60 million people, only about half of them seek treatment, either because they don't want treatment, because of stigma, lack of services. So that's just the statistics on more of a national level.
One of our callers wanted to know about how the family members of people who are mentally ill are affected. What have you seen out there in terms of your dealings with people?
Sure. It can be very taxing on caregivers and family members who really want to help their loved one get more help. And there's an organization called NAOMI that's national and here in Hawaii that has support groups for caregivers. I think it's really important for family members to get help for themselves. Sometimes even getting counseling or therapy for themselves will help them a whole lot in dealing with the behavior, because they can't force their family member to change. They can't force their family member to choose a certain path. And oftentimes just knowing that what they're doing to try to support is enough, and they need to become reconciled with that.
Naomi, did your family members at any time seek help for themselves when they were going along this path with you in terms of mental illness?
Unfortunately not, but they did attend therapy sessions with me, so that was pretty unique, and I find that pleasant, and we got to grow together. But they didn't do it on their own. They actually their focus was taking care of me. My son became the parent, and actually, he was so worried. He put me into treatment, watched me through the whole process, picked me up on weekends. My mom was there, my brother's been there. I really have a very unique, strong base support system and continue that today. I'm really fortunate to have that.
Was there a time that you denied treatment and felt that you didn't have a problem?
Well, I was ashamed. I was very, very ashamed. How can a 39-year-old woman, good education, good family background, you gotta remember my father was a politician, he's well known in the community, he was an ex-police officer, so we had, we're well known in the community. To fall into drug abuse, I was totally ashamed, so I didn't even want to seek help, at times I was just, I isolated.
Donna, one of our callers wants to know how the other people on the expedition or trek are doing today. Did everyone feel like they turned a corner after this trek into Haleakala?
Yeah, after speaking with everybody, I followed up with everybody, as Naomi did as well, and they all said there was growth in their personal lives, in knowing their ability goes beyond what they thought it could, prior to the trip. It's a continuous process. We're always again, trying to find ways to cope. We go through hurdles, and it's just about finding those coping mechanisms and getting through. So.
You know, Anne from Kalihi brings up the issue of veterans and PTSD, and I wanted to ask you, Dr. Lane, about that, because obviously as a clinician and as someone with a military background, you might have some expertise on that.
Yeah, I do see veterans in my private practice all the way back to the Vietnam War and to vets who have returned from Iraq and Afghanistan. The statistics regarding suicide among veterans is alarmingly high. And on any given day, there are 22 veterans, and these aren't veterans that have only seen combat. These are just veterans across the board. On every day, 22 veterans take their life. So there's also a stigma in the military. You know, there's institutional stigma. I worked for the police department, and if you were a soldier or if you were a police officer, if you had issues that you were struggling with, you didn't talk about it because it wasn't the thing to do. It wasn't macho. You didn't fit in. You were seen as weak.
Has it changed at all, let's say, from a generation ago in terms of the stigma of maybe getting help or having an issue with mental illness, or do you think things haven't changed?
Well, my understanding, at least with the military, is that it is changing a bit, because what they're having some of the leaders do now, the platoon leaders, the squad leaders, people that are in the upper echelon, is that they're being trained to work through the stigma, their own stigma of mental illness. And when the troops hear it from their squad leader or platoon leader or company commander that it's okay to open up and talk about this, then they feel more free to talk about it. But a lot more has to happen, because when you have 22 veterans a day that are still ending their life, a lot of work needs to happen still.
You know, someone has a really interesting questions about teachers and what they can do to identify and support students who have mental illness. And earlier, you know, Dawn talked about undergoing depression at the age of 14. So what is your advice to teachers out there who are, you know, trying to get through math class and science, and then all of a sudden they have a student who has an issue like this?
Teachers are some of the best eyes that we have on kids, and mental health issues emerge at all ages, but we do have, Hawaii has some very bad suicide attempt and ideation rates starting in middle school.
Middle school?
Middle school. So we do need our teachers to have the training to recognize signs of problems with their students and to know how to get them help.
And what are the signs? Is it might not be so obvious for some.
I think it's important to look for behavior changes, isolating, changes in their relationships with their friends, you know, looking for signs of changes at home. Really just paying attention and making the appropriate referrals.
Acting out, grades, you know, I guess the usual
Yeah,
things,
all
but
of
it
those
might not be
things.
so obvious that there might be an underlying mental illness issue.
Right, right. And I mean, they really won't know until the child gets professional help.
Pam from Pearl City wants to know the guest's thoughts on psychotropic drugs and their impact on mental illness. Does anyone have any thoughts on that?
Well, they help me. You know, psychotropic medication, it's part of my medication management, you know. It's a big part of helping to keep me stable, you know, so.
When Don was not on medication, we didn't know who he was. You know, we did the best that we could do to support him, even though we felt like we were being pushed away. We felt like we were walking on eggshells. It didn't matter what we said. It was not the right thing. It was really, really rough. It put a strain on our relationship, the family relationship. There's a time and a place for psychotropic medication. Not everyone with a psychiatric illness needs to be treated with medicine. Some people do. It depends upon the severity of the symptoms. When you look at the research, medicine is really good to help manage the symptoms. It doesn't cure the problem. It doesn't resolve the issue. It makes the person more available to do the work in therapy and to make some behavioral changes. Psychotherapy is very effective in treating psychiatric illnesses and disorders. The best of both worlds is when you combine the two.
What about some of the alternative methods of treatment out there?
You know, I've looked into that because of Don's situation. There's higher doses, like 1 to 9 grams of omega-3 that have been found to be helpful for bipolar. But there's not much else. I mean, there's St. John's wort. There's a couple other types of herbs that can be used for helping with depression and anxiety. The problem is you really need to see a mental health care provider first, rather than trying to self-medicate, because you don't know how much to take, you don't know what else it might interact with, you don't know what the side effects of even herbal interventions like St. John's wort does have side effects. So you see a mental health care provider first, you get the assessment, you talk about alternative treatments out there, and you also talk about more of the traditional Western approach.
And do you see, you talked about self-medicating for mental health issues. There must be people out there who are just trying to heal themselves.
Usually what I see is if someone is self-medicating, they're doing it with drugs or alcohol. In the moment, it does help with some of the emotional pain, and it does also create a lot of collateral damage in their life.
You know, Tricia, you've mentioned advocacy, and that's one of the things that you do. What are some of the advocacy options both on Oahu and the neighbor islands like Maui?
So one of the big issues right now is prescriptive authority for certain psychologists, and those certain psychologists are those that have completed a Master of Science in Psychopharmacology and have passed a board licensure for the ability to prescribe psychotropic meds from a very narrow formulary. So that's Bill HB 1072 that we're advocating for in the legislature.
Yeah, and I'm actually a strong advocate for that bill. You know, I've given testimony in person 3 times in the last 2 sessions. It's currently, that bill, HB 1072, is going through the Senate right now with the Ways and Means Commission, or the Ways and Means, and I believe it's going to be decided upon.
Decision making in Ways
Monday.
and Means is on Monday.
Yeah.
And this is a bill here in Hawaii that has failed in the past. Strong opposition from the physician community, where they feel the lack of education or schooling in regards to diagnosing and also prescribing these medications.
First of all, I want to say it did actually pass approximately 8 years ago, where it was vetoed by Linda Lingle. But yeah, there is strong opposition, but I think a lot of that opposition comes from misinformation, you know, regarding the curriculum, for example.
Well, and I think that, you know, people have safety concerns, and I think it's really, that's important to be concerned about the safety of patients and make sure that they're being treated appropriately. But this bill does provide the proper safeguards, and we feel that it would be a safe option.
Absolutely. We don't have a physician on this panel tonight, but Dr. Lane, your thoughts on this?
Well, there's a lot of bad information out there about this bill, unfortunately. I've had psychologists on Maui ask my opinion about it, and I'm personally in favor of the bill, and they were surprised, and their rebuttal was, you know, how can you be for this bill when all a psychologist needs to do is do a 20-hour course in psychopharmacology and then prescribe. So what they don't know is that if you look at the curriculum, this program, or the programs that they offer, is actually a 2.5-year program. You have to be licensed, I believe, as a licensed clinical psychologist for 2 years. You go through this 2.5-year program of coursework that parallels the coursework that nurses and physicians get going to medical school. After the training, you're supervised by an MD for a year while you're prescribing, and then you have to pass a national licensing exam. And that's on top of a psychologist that already has 9 to 11 years of education in psychology, human development, plus 3,000 hours of a postdoc and completing a national licensing exam.
Sounds pretty extensive.
It's extensive.
I wanted to just read a comment from someone anonymous. This person says, this documentary and discussion are very good. There needs to be a way to put both of these on the internet. Well, you can find this discussion on pbshawaii.org. And will your film, Haleakala, be on the internet, available for all to see one of these days?
Well, I'm looking at options right now. That is the goal. That is the goal. Next step would be to get it national. And then after that, make it available in other venues or vehicles.
What were some of the other links in terms of making this film and the transformation that the people went as they went through this journey together?
I'm sorry?
What were some of the transformations that they went through?
Oh, again, I think a lot of it was they felt, or they knew, after going through that rigorous journey, physically and mentally, that they could accomplish more than they thought before they started the journey. That was a huge transformation that I heard from multiple people that went into the crater.
So I think the idea is you're more than a label, you're more than a diagnosis.
Yes.
This is a small part of a much bigger components that make up who you are. I'll have people come in and they'll say, I'm depressed, or I'm bipolar. And I'll say, wait a minute. No, you have a diagnosis of that, but there's also all these other parts of you, other than just being someone with this diagnosis.
How did hiking into Haleakala change you as a person?
Well, again, I think it brought me a lot closer to Donnie. I wanted to do whatever I could do to reach out to him. That's a very important component to helping someone that's suffering from a psychiatric illness. Even when they're pushing you away, be there. Call them, let them know you're thinking about them. If they push you away and don't want to talk to you, stay in contact with their friends, because their friends will know what that person is doing. And you have a better opportunity to do an early intervention, even if you're just in contact with the friends of your relative.
Yeah. That's something that really helped me turn a corner, finally knowing that some people were around me. I had that support base. I had NAOMI. NAOMI helped me a lot. I had my father, my stepmother. I had a large support base that I just did not see. But when I finally saw it, it really helped me turn that corner. That support base is extremely important.
It's interesting you bring up the topic of people who at that moment do not want help. And it's got to be really, really hard for those around them to try to get them help if the person doesn't want help.
If the person doesn't want help, the best you can do is let the person know that you're there and available. So just a short story here. What happened with Don when you were not on your medicine was that he came and he lived with us. We have an attached ohana. And it was incredibly difficult and challenging. And there were things that, as a parent and as a mental health professional, that we knew were important for him to do that was in his best interest. And in the midst of what he was going through, he was doing the opposite. So then as the parent, I did the very difficult, challenging thing and said, this is what I need to see you do if you want our help. If not, come back and let me know when you want our help. And it resulted in you leaving the house and being homeless. And that was really painful as a parent to have to go through that, knowing that I had to set those limits because I knew professionally and as a parent it was in his best interest, and knowing that my son was also homeless on the beach when he had a place to stay.
It sounds like tough love. NAOMI, is that what pretty much your family did too? There was some tough love there.
Tough love.
Can you go into detail about that? It's when your son was your parent.
Correct.
At that time.
It's really sad to have your son having to take care of household duties. He was going to school. He and my mother would, try to take care of me when I was isolating and just falling apart. So he made the call. He made the call to the treatment center, and I remember him talking to the gentleman on the phone, and the gentleman said, unfortunately, I can't talk to you. You're a minor. Please put your mom on. And he handed me that phone. He's like, you got to do this. And then, a light went on, said, I need to do this. I need to make a change. And I was really, really grateful that I did that.
And dealing with people who have mental illness, do you find that there are family members and friends who perhaps enable the illness? You know, if the person is
Yes.
very strong and doesn't want help, and you know the family member is still trying to cope with their illness.
Yeah, I think it's a lot of uneducation too. You know, they don't know what to do. They don't know where to turn. A lot of it keep it in the household. They don't talk about it. So, you know, as a case manager, I encourage people to, you know, talk about it. Tell somebody. You know, seek help. Seek self-care help. That's huge.
Right,
Yeah.
right.
You know?
I'd like to say that's really where it begins, and that's what we're doing right now. We're discussing the issue, and once you discuss it, it becomes normal. It
Well,
becomes
that helps
accepted.
remove some of the stigma also
Right.
by openly talking about it
Right.
and disseminating accurate information. That's really important.
And what about the family members dealing with their own emotions of trying to help a family member who perhaps doesn't want help?
Yeah, it created a strain and a challenge on our marriage. We didn't reach out outside of the relationship for support. I think part of that was because we have a very strong relationship, a very strong marriage. I think the other part of it, you know, maybe I still have some remnants of mental health stigma myself, because for me, if I needed to see a therapist, I know most of the therapists on Maui. And I would see a therapist. I have. We have with our daughter when she was going through some issues, some anxiety issues. For me personally, I would probably come over to Oahu and see someone because I have too close of a relationship with other mental health care providers on Maui.
Dr. Gray, a clinical psychologist of Oahu, wants to know, what happens if a mental illness patient cannot access their medication? Tricia, what have you seen?
Well, then that's when you find people going into crisis. So not every person with a mental health disorder is one trigger away from a crisis. It depends what the problem is. But somebody who needs medication, who's been prescribed medication, that can't get it, is a lot more likely to end up in the ER or in a severe crisis.
And what about people who are low income? Even if they do have insurance, they still have to pay co-pays.
Yeah, it depends on your insurance coverage, but co-pays can be prohibitive for some people, depending on their living expenses. And as we know, Hawaii has such a high cost of living that it's very challenging for people to afford medical care in general.
And so what can people do to level the playing field if they have challenges paying for their medications?
We need to work on access. We really do need to work on access. We need healthcare to be more affordable, and we need to work on the health disparities that we're seeing among ethnicities and income levels.
Don, you had something to say?
Oh, I was just going to say, yeah, I have a personal story, and I've heard the story from several other individuals, that cope with mental health issues. That one individual, a friend, for example, had to admit themselves to the hospital to be able to get their prescribed medication, because they couldn't get a hold of a psychiatrist or prescriber, an APRN, to be able to prescribe that medication for them. And that was the only way they can get that and not go into crisis. Same thing happened with me. Similar thing happened with me. Having to go to the ER twice, and the second time they didn't want to prescribe a medication. And I understand they're not a pharmacy, but where else do I go? When it comes to that point. And luckily, I had NAOMI, who told me about mental health Kukua, and I went through the program, and now I work there.
And is that how you two met? How did you two meet?
Well, I was a peer coach at Mental Health Kokua in 2010. I met John. He was one of my first clients.
Yeah.
And so we've been working with each other for a number of years. And just so happened, I invited him to a film festival.
That's right.
And I
Dr.
dragged
Tom
him.
Bendetti.
He wasn't going to go. He was in the group home. He wasn't going to go. I said, you got to come on, because I know he's into filming. And he spent the whole entire day there. I think he watched every film. And then he got introduced to Dr. Vendetti, and the rest is history.
It was funny, because if I didn't go, the film probably wouldn't have been made, and I wouldn't have come even further into my
so
recovery.
We've been friends since 2010.
Well, fantastic. As we start wrapping up the discussion, Tricia, you have entered, or you've been in this field for a very long time, very challenging profession. What keeps you going, and what keeps you so dedicated to helping these people?
I want to see social justice. I want to see Hawaii be a fair place for people who are disenfranchised or disadvantaged for whatever reason. And so this is an area that I really feel that we can do better in. We can provide more care, we can give people more access to treatment, and we need to.
Naomi, what do you see as the solutions for helping more people with these mental challenges?
And just educating the public more, educating them, being more compassionate, being more open-minded.
What about you, Dr. Lane?
Education and training for half the people that see their primary care physician and they have a diagnosable psychiatric illness, it goes missed. It gets misdiagnosed and they don't get the appropriate care. So part of this begins with educating other medical health care providers, registered nurses, APRNs, primary care physicians. They have limited training in psychiatric issues. And even with medication, I'll have some physicians that will call me up and they'll say, what do you think, what antidepressant do you think this person should be on? So we'll talk about it a bit, and obviously that final decision is up to that physician. But we need more physician training. Training in the educational teachers. They need to be trained about mental health issues, how to identify the issues.
Well, thank you so much to you all tonight. It's been an enlightening discussion, and good luck with the film.
Thank you very much. Appreciate it.
Well, Insights on PBS Hawaii will not air next Thursday as usual. Instead, we bring you a special presentation featuring 2 Hawaii women who will compete for berths next week on the U.S. Olympic wrestling team. Join us for the film Winning Girl, showing the athletic journey of 18-year-old Tishaya Alo in her first shot at the Olympics. And we'll talk with an Olympic veteran, Clarissa Chun, who says this will be her last shot at aiming for Olympic gold. Thank you for joining us tonight on Insights on PBS Hawaii. A hui hou.